I believe that training and education of our residents is the single most important thing that we do. It's very, very important for the whole country, for the whole nation, to have well-trained surgeons in this area. Cardiothoracic surgery treats the #1 killers in the human population: cardiac disease and cardiac ischemic disease, as well as lung cancer.
I'm a deep believer in that the best way to learn is to teach.
We have really a world-class both cardiac and thoracic surgery program, and it's really an opportunity to be able to train the next generation of surgeons.
I can't wait for the opportunity to work with someone who's going to be doing what I do for a living.
Jefferson has a rich tradition of training cardiothoracic surgeons ever since the days of John Templeton, who himself assisted Dr. John Gibbon in the first open heart surgery in 1953.
They didn't have any way of doing really good diagnosis. Dr. Gibbon, he was quite a pioneer. He did 5 or 6 cases. The second one was a success, which marked the beginning of cardiac surgery as we know it today, utilizing cardiopulmonary bypass. Done right here at Jefferson Hospital. That patient lived for another 60 or 70 years.
Ever since then, training cardiothoracic surgeons has been a tradition and commitment at Jefferson. Recently, this commitment has been rekindled.
We're very excited to initiate the Cardiothoracic Surgical Fellowship and Residency Program.
A training program here allows trainees access to all types of cardiac and thoracic surgery. We really are focused on patient-centered care with a cutting-edge, most innovative care.
We're putting together a stew that is going to allow a trainee to have multiple different ways to attack certain problems.
What excites me about training the future generation of cardiothoracic surgeons is the mutual exchange of knowledge.
If you go into one of our ORs, you'll almost always find another one of us just there to hang out or to talk about the case. That's not what you see in cardiac and thoracic surgery programs across the country all the time.
One of the other things that we have here that not a lot of other places have is a great complement of benign disease work. We do a fair amount of benign foregut work. We have a newly minted chest wall center where we take care of people with pectus excavatum, thoracic outlet, slipping rib syndrome. So there's an opportunity here for people to come and train here in things that are not commonplace all throughout the country.
In addition, the diverse backgrounds of the faculty and their training should not be underestimated.
When I started here 15 years ago, we did essentially no robotic surgery, and now it's most of our practice, and that's really a testament to how we focus on what's best for our patients. We are much more involved in the care of our patients from start to finish. We're involved with and are partners with medical oncology, radiation oncology, other parts of surgery, way more than I ever expected when I started.
I've been training residents intensely for over 30 years. We're talking about a relationship across the table, maybe 24 inches. This is an intense relationship.
I think the ideal candidate for this fellowship is someone who can just really commit these years to learning everything that they need to learn in order to go out and be a safe, high-functioning practitioner of this art.
Philadelphia is an incredible place. It's kind of a super region, has a great history.
As faculty and as trainees, we've been so happy here because of just the incredible depth of things that you can do here, and it's really a city to make your home.
I look forward to continuing our rich tradition as we train future surgeons in cardiothoracic surgery at Jefferson.
We're looking forward to the idea of having a brand of Jefferson-trained cardiothoracic surgeons.